Something which I think will really be a special treat, and I greatly thank my panelists. My goal is not to say much, but just to tee it off and have some really great discussion. And as many of you know, I was class of 1980, and I think that it's fair to say, and I saw this certainly acutely when I was there, that Hopkins was not always the most female-friendly place in the world. You know, the women face special challenges, and we picked this panel, the council picked this panel carefully because these four panelists represent sort of different eras of Hopkins, and they can talk about, you know, what it was like, you know, way back when, and then not so far back then. And let me ask the four panelists to come up and have seats up here. We have Kathy DeAngelis, former Vice Dean here, and you're each going to say a little about yourself. Sherita Golden, the Vice Chair of Department of Medicine. Julia Haller, the Chairman or Chairperson of the Wills Eye Institute in Jefferson in Philadelphia, and Redonda Miller, the President of Johns Hopkins Hospital. So we have four extremely accomplished people who will be talking today. Let me grab the microphone to start, and I'd like each of you to, you can make sure the mic is live, to introduce yourselves and just say a little bit about yourselves so people can understand where you're coming from. Perhaps okay, I think there was a problem of a switch. So describe just briefly, all of these four women have extremely long CVs, and we can't possibly go through all of this. So we want you to just briefly talk about yourself, what class you were in, and sort of what your perspective is, and then we'll get into particular questions.
Well, I'm not a medical school graduate, but I did my pediatric residency here, finished in '72, came back on the faculty in '78, and they've been stuck with me since.
It's really hard to follow Kathy DeAngelis. I was born at Hopkins.
Well, I was probably on the faculty.
No. And my mom was an obstetrician here. My dad was chief of pediatric surgery. I came to Hopkins for my internship in 1980. I was an intern in surgery. There were three women. I was thinking this driving down. There were only three female interns, and Dr. Cameron was kind of the, you know, the big force in surgery. He wasn't chair at the time, but he was the big force. And so they called us Cameron's Angels, and I was just cringing thinking about that because, you know, Charlie's Angels had just come out and was a TV show and stuff. And I'm going like, why do we think that was a compliment? I mean, you know, it's like so sexist. But anyway, then I stayed on, and I was here for 27 years before I went to Wills Eye Hospital. So I was an intern, then I did my residency in ophthalmology, my fellowship here. I was chief resident and stayed on the faculty.
I'm Sherita Golden. I did not go to medical school here either, but I came here in 1994 as a Janeway intern on the Osler Internal Medicine program. I heard a few shouts out for Janeway. And I did a fellowship subsequently in endocrinology, diabetes, and metabolism here, joined the faculty in 2000. I've been executive vice chair of the Department of Medicine for the last 4 years, and a month from today will assume a new role as vice president and chief diversity officer for Johns Hopkins Medicine.
Hi, my name is Redonda Miller. I came to Hopkins 31 years ago from Ohio, small town in southern Ohio, and have been here ever since. I finished med school, general internist. I did my residency here. I managed to get around to all four firms, though. Med student, Thayer, house staff, Long Cope. No, I got that messed up. Med student, Long Cope, house staff, Thayer, Barker, ACS, and then Janeway firm faculty. So I got to see it all. I joined the faculty then after residency and was a clinician educator for a while, focused on women's health, and then had a mid-career transition, sort of became enamored with healthcare delivery and perhaps enamored and frustrated at the same time because, you know, as a provider, it can be challenging nowadays. So went back and did an MBA at the Carey Business School, changed careers a little bit, and went into hospital administration. I'm currently the president of the hospital.
I should have mentioned, if you can't hear me, I want you to tell my husband, okay? Oh, okay. I forgot to mention that I've been here physically since '78, except for 12 years when I went to Chicago to be the editor-in-chief of JAMA. But even during those 12 years, I maintained what people say is my reputation here, which is being the resident PITA. That's pain in the ass.
Well, let's move on up, you know, and we don't have to.
Oh my God.
So what I'd like you to do, and we don't have to go in order here. You know, this is now a free-for-all. How did being a woman shape your experience at Johns Hopkins?
Well, if you want me to start, I can tell you that in 1985, I was the 12th, and that's 93-year history of Hopkins, the 12th woman professor. That set me off. And so come forward about 5 years, when I was the only woman on the faculty advisory committee, which was all the department chairs, except medicine and peds, each had 2 representatives. So I was one of the representatives from pediatrics. The dean then, Dean Ross, was given a report by the provost that said that women faculty in the School of Medicine were not paid the same as men, and that he was to do something about it. So he asked me what he, for some advice, what he should do, because he had to report this to all the department chairs, of course, all men. Well, I looked at the study. It was done by the School of Public Health. I said, the study's all wrong. And I told him what was wrong with it. For example, there were more men surgeons than women and more women pediatricians than men, and surgeons make more than pediatricians, et cetera, et cetera, et cetera. And he asked if I would do the study. And I said I would on 3 conditions. One, that I would meet with every department chair within 2 weeks and show them what I planned to do and get their input. They could change it any way they wanted, so it would be their study too. Second, that I would have access to everybody's salary, confidentiality, of course. And third, that if we did indeed find that women were not paid the same as men, which I was sure was true, that he would make it up in 2 years. And he said he would do it. And the rest is history, because indeed, women were not paid the same, and it cost Dean Ross $2 million over 2 years to get the equity for women and men. And I continued that study 1 weekend every year for the next 10 years, because then I went over to the dean's office. Part of that study and looking at everything was that I saw women were not being promoted. Also no surprise. So when I went to the dean's office as the vice dean for academic affairs, and within 2 weeks, I also became the vice dean of faculty, I looked around and there were about 17 women professors here. And I said, okay, women, we got to get together. We're going to form a network, and we're going to get women promoted. So every professor, woman professor, took 2 associate professor women who seemed like they were well on the track, and we met with them. I also met with the professorial department chair and the whole committee, and we had sometimes monthly meetings. And by the time I left, when I went over to the dean's office, there were, I think, 27 of us. When I left, there were 70-some. When I left, Janice Clemens took over, and soon joined by Barbara Fivish. And as of this week, we have 272 women professors.
Well, I was number 83 in 2004. And interestingly, everybody knows what number they were. So when you can count them that easily, it does say something. For me, being a woman at Hopkins meant, particularly in surgery and surgical subspecialties, which had historically not had very many women, it meant that I was, I think, more on my toes and a little more aware of being asked what my opinion was as a woman about some things, like I represent all women. And I think it did probably push me to mind my P's and Q's a little bit more and make me a little bit more alert. But again, I look back at those days and we were pretty clueless. This is way before, hashtag I look like a surgeon, hashtag me too. So, when I think of some of the stuff that we put up with, and tried to have a sense of humor about, it wouldn't wash anymore at all. But having said that, Hopkins was a place that had very many warm pockets of mentorship and male mentorship, too. There weren't enough women to mentor me as a woman, but had really great male mentors. So it was a place where I could flourish. Having said that, there was a lot of room for improvement, I guess is what I would say.
Yeah, so I want to make two points, I guess, to that. So the first is just a comment on sort of me feeling very blessed to have been a beneficiary of the early work. So I was number 198. I wanted to be the 200th woman professor, but missed it by 2, however the votes were at the ABMF, but I was 198. And I think what's been really exciting is that in 2015, we had a celebration for reaching 200 women professors. And just 3 years later, in 2018, we had the celebration for reaching over 250 women professors. So I feel like now we're actually going at logarithmic speed, which is very exciting. And in my own department in medicine, we have 5 female division chiefs. So we have 20 divisions, but now we have 5 female division chiefs. Mark Anderson, who's our current chair, has been a terrific leader for promoting women's careers. And then out of our 14 vice chairs in the Department of Medicine, there are 8 of us that are women. And so we call ourselves the Lady Vice Chair Group. Not that the men can't have their group, but I think that really speaks volumes to the progress that has been made. I think the one thing I will bring up that, for me for years, honestly, was uncomfortable to talk about, but as a leader, I felt like I've needed to, is my experience as a woman was more shaped by the issue of intersectionality. So what it was like to be an African-American woman. Because, people didn't necessarily mistake me as the nurse. They often mistook me as the dietary staff or someone who was coming to clean. And actually, when I was an intern, I walked into a patient's room and she said, "Oh, I'm so glad you're here. I've been waiting for somebody to turn my TV on all day. Are you the TV lady?" And of course, her daughter was mortified. Her daughter was like, "Oh my God, mother, you're so ignorant. That's your doctor." But this was like a repeated experience during my training experience. So many of you who are Osler House staff remember that last year was the first year our intern class did not wear short white coats. And everybody was just so up in arms, like you would have actually thought we were changing the name of the program. But for me, as an African-American woman, had I had on a long white coat back then instead of a short white coat, some of those mistakes probably wouldn't have happened. So I think there's 2 perspectives. And then I guess the third thing I'll say about that, though, is being an African-American physician, the support and love that I felt from the support staff here, who was so proud of me, created this whole extended family. So for any of you who remember Otelia Green on Halstead 4, she introduced me to my husband. That is why we are married. So, when I say the support staff are really supportive, they were really supportive. So anyway, I just that was sort of a unique part of my experience that I wanted to share.
Uh-oh, I have Charlie Wiener to thank for my husband. Oh, no. So anyway, I think back, my generation were truly the beneficiaries of the good work that went before us. I remember when I entered medical school in 1988, we were the first class that was 50% women. It was a hallmark. And then as I finished residency and Dr. Hellman was selecting his chief residents, if you recall, in internal medicine, there are 4 ACSs, 4 chief residents. 3 of the 4 were women. Wow. That was unheard of. And by the way, all 4 are still here. Yeah. But so it was just a sign of the times, and that put me in a different frame of mind. When I looked around in my world, going up through the ranks in medicine, I saw women. I didn't see as many women above me as I would have liked to, but certainly in my cohort, I had plenty of colleagues who were female, and lots of commiseration and collaborative work. It was a different vibe. Now, I will say I'm not so Pollyanna as to think there aren't still issues. There clearly are, and whether it's salary inequity that some medical schools, I think Hopkins has done a great job, by the way, of working aggressively on that. But certainly we know in medicine there are still significant inequities that people are working aggressively on. What else do I want to say? I'll just sum it up. It was just different. When I sit now in meetings, I don't necessarily see gender lines. And it's interesting because someone may point out to me, if you can imagine a finance meeting at the hospital, for instance, I guess sometimes I'm the only woman in the room. But it doesn't dawn on me to think like that. And honestly, I will say that is a testament to the work that you all have done. So thank you for that.
One thing I should tell you, way back in 1990, we fit all the women professors on one page, plus had room. And so the goal was we were going to fill many pages, which we have. But Meta Strand, who was a professor at the time, she said, Kathy, what are we going to do when we fill the page? I said, we're going to use a smaller font. And the rest.
Well, what would you say are some of the challenges then? I mean, life was not perfect, so where were the challenges?
I'm happy to start on this one. I will tell you that the one challenge that I find is still work-life balance. It is a huge challenge. I married the greatest man in the world. I will tell you, he's wonderful and he helps. We did a handoff from one lacrosse field to another this morning already. We've already got all of this day in motion. But a Baltimore handoff, that's right. But I will tell you that it's still, women tend to take on the role at home of organizers, and I have two daughters, they're 10 and 14, so it is a busy time of life. I think my role is a driver sometimes, an ATM machine, and an organizer, and trying to balance that with work can be challenging. Even in the best possible scenarios, I read a study, I guess this was just in the last couple of weeks, where they looked at men and dividing home life, and it used to be around 10 or 15%, and it's changed a lot. And in general circles, men are doing probably 35% of the homework, work around the home, the organizing, the child care. But it would be helpful, I think, in my world, just to have a little more of that. That is my biggest challenge, is just balancing all of that.
Yeah, I would dovetail that same thing, and I think, I think one of the things, so typically for women who are in the medical profession, it's not uncommon that they're going to be married to another medical professional, and so, I will say that early in my career, there were times where, my husband and I, so he's a neonatologist, so I joke that he has real call. So I'm an endocrinologist, and I may have to answer something about an insulin error, but, his NICU call is real call. And so, but there would be times where, we'd have to balance how we were managing all of those things. And comments would be made to him asking, well, why can't your wife do that? And so I do think as we're thinking about work-life balance, it's not just for women, it's also for men, because they are also wanting and trying to partner. But if our perception is that it should still fall on the woman, then we're not going to strike the proper balance. So I just want to add to that comment that a lot of times we talk about work-life balance for women, we also need to think about it for the men too, who are having to support the women and the whole household.
That's I totally agree with that, but I'm going to say something different because you guys have already covered it pretty well. Although on that topic, I really see, as I look at the residency classes that come through from my position as chair of the department, the men are right there. They're taking paternity leave. They want to do everything they can to feed the baby and get up at night. I had this moment when I was a visiting professor at Columbia a couple of years ago, and I went out with the retina fellows, who of course were all male. And they all wanted to ask me about childcare and how I thought, whoa, this has really changed. But I did ask a key question, and to this day, this has never failed me to bring home the point. I go, I know you guys are taking the kids to school. I know how many well-child pediatrician visits have you made for, scheduled? And it was 0, and it's pretty much still 0. It's just something that the guys don't think about. But on another topic, I worry that we're losing ground, and that is because the young women are coming up thinking the battle has been won. They weren't there on the front lines, for feminism and things, and they weren't the first. Now there's a whole generation that's gone before, and so some people think the issue is over. But we need to keep working on educating them about all the scholarship that has been done. It was in 1996 that Linda Fried was first author, and they published the results of 5 years of Hopkins changing its education of faculty, letting women know where they could have mentors, letting them know the criteria for promotion, and they showed a 550% increase in the number of people who went on to be associate professors, which was the key step that was missing. That was 96. But I still have residents coming in saying, okay, I'm going to go negotiate my first salary, and I'll go, well, don't take the first offer, and they'll go, why would you say that? So for them not to know that as women we're going to take the first offer and that the men are going to be paid 15 or 20% more, even in this day and age, I think it's a little discouraging to me. Yeah.
Well, the challenges that I saw in mentoring women were the whole business of negotiation. Women just didn't know, and I'm going to tell you something, there are a lot of women who still do not know how to negotiate. For example, women were asked and still are asked to serve on a lot of committees that count nothing towards promotion, anything to do with education, anything to do with lots of things. So I said to them, okay, and they were afraid to say no. So I said, okay, you want to serve on committees that, 1, have anything to do with money, or 2, have anything to do with promotions, or 3, the selection of a division chief or higher. Now, so if you're asked to serve on a mini committee that won't get you anything, you say, okay, but I also want to serve on a different one. That means something, okay? The other thing about negotiations for salaries, people didn't know. You can get salaries at places. If you can't get it from someone at that place, if you're negotiating for a job, the AAMC has all those data. And I helped them to decipher how that money really came down to that particular position. And it was amazing to me that it was, back in 1990, it was there, and it's still there for many, many women. And when you look at it, there's still only 16 women deans in the United States, and not that many department chairs, nowhere near the number that should be.
Well, our time is growing shorter, so what I'd like to do is say, what would you say we can do to help women achieve leadership positions? What advice do you have for the next generation about achieving this?
First of all, marry the right guy. Second of all, I'm going to tell you something that made a big difference. I was asked to be the pediatrician for a lot of the house staff and faculty. And one of my rules was that the doctor, the father, would have to, it was usually somebody on the house staff, would have to make at least some of the visits, and certainly the first visit. During that first visit, I insisted that if I was going to be the pediatrician, that the father, almost always a guy, would feed the baby at least once a day, or for the surgeons, 4 times a week, okay? But I knew, but they had to do it. Bear the baby only in a diaper, and they with no shirt, so that it would be skin to skin, okay? And they could put a blanket on the baby or something, but they would feed the baby up close. Well, I didn't get any people who said, oh no, except the surgeons. And they said, well, we can't do that. I said, well, then I can't be your pediatrician. And so they said, well, will you tell anybody? I said, I'm not going to tell anybody. To this day, in fact, it happened to somebody out there. The son of one of these people came up to me and said that his father had told him he had to do it because he did it, and what a joy it was. And it also made the man more cognizant of parenting and helping the women with a lot of chores that had nothing to do with feeding the child. That's just one example.
That's really good. Was a question of advice in general, yeah. So I have a lot of women who come in and say, you know, I want to do this, I want to do this, I want to balance this, but but also I want to be like you, and I just tell them right out, it's really hard, and I don't think you can go into medicine thinking that you don't have to work really hard, and that's kind of in the Hopkins DNA. Probably we lose some students because people think of Hopkins as being where Marines go to train. It's a little bit like a SEAL Team 6th place. So it does self-select for people who are going to do that. But the other thing I think is informing yourself about what we already know from the past. And so, the basic, actually, Sheryl Sandberg's dad was here last year at reunions. Joel Sandberg is a Hopkins alum. He's an ophthalmologist in Florida. I was so excited to meet him. If I would much rather meet Sheryl Sandberg's dad than Bradley Cooper's dad or DeAngelis' dad or whatever. I was like so excited. But her book, lean in, have a seat at the table. When I left Hopkins, Ed Miller debriefed me and he said, were there any things you were disappointed in? Yeah, there were some things I wish I had gotten a chance to do. And he goes, well, when you put your hat in the ring, did you make a big point of saying how much you wanted? And I was like, well, no. I kind of hoped everybody would just realize I would be perfect for the job. That is terrible. You can't be disappointed about stuff that you haven't really advocated for yourself to get. So those are all pieces of advice that I would give, and I think we have come a long, long way. And I'm so proud of Hopkins that it was a place that started with women, and I think it's made great strides in its example for the world. And I love hearing about being a woman of color too, because I think hopefully, there are lots of, marry a great guy, marry a great gal, LGBT. There's so many identifiers out there that we need to work to erase, so, and differences, equity-wise. So, anyway.
Can I just, as far as advice goes, a lot of the people I've mentored ask me if I would write some of the lessons I learned and some of the things that happened, and I did that. Now, please understand, I did that. I wrote a book. I make no money on this book. Any profits go to the Child Life program here at Hopkins.
We wouldn't think any less.
Well, no. But in that book are 17 life's lessons learned and stories behind them. So if you really want to know what I think and how I thought about them, they're in that book. And I'm sorry, I don't.
And Kathy just told me in June it's coming out with her reading it in Audible format. So I have that. I just put that on my list to buy that when it comes out. That should be awesome. Yeah.
Okay. Thank you. That's a plug for the Child Life program.
So I have not written a book about my advice at this point. So, but I just want to say three things for encouraging women in leadership. I think the first is to be realistic about what your priorities are and what you can do at the same time. So when I was in high school, there was this song by Shaka Khan called "I'm Every Woman," and then Whitney Houston remade it when I was in medical school. And within weeks of the birth of my son, I was like, I am clearly not every woman at the same time. And so I say that to say that throughout my own career and this is the advice I give women aspiring to leadership, is that I was very focused early on as I need to get promoted, I need to get known in my field. So I would hire an evening babysitter so I could write papers in the evening, so I could still do all the mom things, but from 7 to 9, I was in my office finishing those papers. And when I traveled for work, I picked the conferences to speak at that really mattered the most for what I was trying to do, and I would fly in, do my talk, stay over, and come right back home. Okay, so I did that probably, I would say, for about 14 years until my son was in high school, at which point, then when the executive vice chair opportunity was available, he was almost ready to drive and really no longer wanted me at his activities. And so at that point in time, I actually had much more freedom to stay at the meeting longer, to take on new leadership opportunities. So I think the key is for women to figure out, to be really focused at various stages of your career on what's needed at that stage to get to the next. I think the second point is to really tell people what you want to do. So Redonda is like one of my leadership sheroes. I hate to embarrass her, but she was an ACS when I was a senior resident, and then when I was building the hospital's inpatient glucose management program, she was vice president for medical affairs. And she gave me some really good advice, which was, you've got to tell people what you want to do, which mirrors exactly what you just said. And so, I just remember saying to my division chief, I really am interested in departmental leadership. And he literally pulled the executive vice chair job out of the trash can and said, I'm not going to apply for this because I'm ready to retire, but you should think of applying for this. So if I had never had that conversation with him, it would have never occurred to him to promote that opportunity. So I think women have to actually say what they want. And I think the other thing is, our women vice chairs are reading this book, How Women Rise, How to Break the 12 Habits That Are Holding You Back. This is really fascinating. We're going to discuss it tomorrow, but it talks about how we sometimes assume that if you're doing a great job, someone's going to notice and then they're going to promote you or give you an opportunity. You actually have to articulate what you want to do and what your vision is. And I think the last thing I would say is, don't be afraid to fail. So fail is first attempt in learning. So not the way we think of it. And I joke, I'm a researcher, and so that's why we call it research. When it fails the first time, you got to go back and do the experiment again. But I think we have to look at things that way. And I actually gave my son that advice when he went to college. But I tell women that too, is you have to take a risk and not be afraid to fail.
So, advice. Some of my advice would probably get me into trouble. For instance, we have family dinner at 10 o'clock at night, and we have since the kids were 6, and it's just how it is, and it works out well. I tell them we're European, and they seem to believe it. And then everyone goes to bed at midnight, including the 10-year-old. Don't call Child Protective Services, please. We live really close to the school, and it all works out. So you just make it work. So advice, I say that offhand because you may not want to take my advice, but here it is. I have 2 pieces of advice. One, Sherita alluded to. I think women sometimes get in our own way. We don't put our hand up. We don't say, gosh, we want to do this. My career, I remember vividly meeting with Mike Weisfeld, who was chair of the department. I was doing quite well as a clinician educator. I mean, I loved my job, but I wanted to do something different. And I was scared. I'm not even sure he knew who I was. I was one of his 450 faculty members. I sort of lived in Jayhawk. But I just got my courage together, made the appointment, explained what I wanted to do. He said, okay, well, let's give you a project. And my first project in healthcare delivery and sort of administration was sitting in the basement of Phipps with medical records team. We had paper records at the time, going through, figuring out how we can improve physician documentation. Sound familiar? We are still working on improving, but I put my thoughts together and explained it, and then the finance people put numbers around it and said, okay, if we can tell what stage of kidney disease and if we can code malnutrition, it all sounds very familiar, that we'll code and be reimbursed $12 million more. But if I had not had that meeting with him, and then from there, every step of the way, if there was a job that came open, the vice president for medical affairs, for instance, I doubted myself. I didn't think I was ready. I had only been the vice chair in medicine for 4 years. And heaven forbid, and look at this job description. What could I possibly know about credentialing or pharmacy or spiritual care? But with his encouragement and my husband's, just put your name in. If it's something you really want to do, you need to go for it. You will learn it. Someone told me a piece of advice that still resonates. Women look at a job description and they see 10 qualifications. And we say, oh my gosh, we only have 9. We could never do the job. And some men, my husband included, would say, oh, look at that. I've got 5 of these. I'm good. Why wouldn't they hire me? And that's not meant as any insult to the men in the audience, because I think the men have it right. I think the men have it right. Anytime you move up in your career, you have to learn new tasks, new subject areas, new content. You have to. And so we women, my advice is don't doubt yourself, just go for it. The second piece of advice, I told you there were two, is this notion that women can have it all, or for that matter, honestly, that anyone can have it all. I don't believe that. I believe you have different parts at different times. You have priorities based upon where you are in your life. So if you said, oh, Redonda, what's your dream? Yeah, I would love to take tennis lessons. Sure, maybe I would like to learn Brit, all of these things. But right now, my focus is work and my family. And I love it, and I'm happy, and I'm content. And I make it to the important things for my girls. I work in an environment at Hopkins that values that and have set priorities. And I have no fear of going to my boss and saying, hey, I can't miss the middle school talent show, my kids singing a little song from Annie. And the answer will be, you must go. But oh, yeah, and I make sure I say it to my colleagues and people who report to me at meetings. I don't want you to miss the important things. The routine things, you're going to have to sacrifice a little, but the important things, you have to be there. And they get it, and they do it, so I think there's some role modeling in that helps. But back to this prioritization notice, I will be the first to tell you that the last movie I saw in a movie theater that was not animated was Seabiscuit. I think it was 2003. Okay. I don't read any good trashy novels. I don't get to watch Pop TV. I missed all of Game of Thrones. I don't watch it. I missed Orange is the New Black, House of Cards. I missed it all. But it's okay. I don't mind because I love my job and I love my family, and those are my priorities now. And when my kids are gone, that may change, and my priority may be Game of Thrones. But it's over. I missed it, right? I missed it all. I missed it all. So those are my two pieces of advice.
What sort of things have you not said that you want to say? We have this long list of questions, and there's no way we're going to get through it. So what other sort of advice or experiences can you share, that'll help people in the audience, and hopefully this will get transmitted to, younger generations. What do we need to do to help women, achieve what they want?
Well, one of the things I think that women lean away from is taking risks. And if you don't take a risk, you're never going to advance. And so don't expect to win everything. And don't expect to go after everything and that it's going to come. Every time you don't accomplish something, you'll probably learn as much or more as when you do accomplish something. But if you really have an idea and you really want to succeed as a leader, remember 4 4s. There are 4 things you have to keep in mind, and nicely they all start with T. First, you have to have tenacity. You know you have something, and you know it's a good idea, so you go after it and you keep after it, even if you fail, and you keep doing it until you succeed. The second thing is you have to have, oh God, I forgot the second T. Okay, it'll come back to me. No, it's it doesn't matter, but it's like tenacity, only that, it's tough-minded, not tough, tough-minded, that you know you're right. Now, you don't put people down, but you know you're right. And that's why you need the tenacity to keep after it. The third thing is something very difficult for women, and that is you have to have thick skin. You can't personalize defeats. You can't personalize people saying bad things or nasty things or snide things about you. The fourth thing is easy for women. You have to have a tender heart. And you need the tender heart to forgive the SOBs who caused the first 3. And remember, the 5th is the big one. The higher up you go, the more you become a target, and why you need those first 4.
Wow, that was really good. I'm trying to think of something new. Here's something. What you all did back in 1990 that you reported on in 1996 was first you measured and you found the difference. So I would say we need to keep measuring and getting metrics. I was just sent an article to review that showed that women in ophthalmology over the last 10 years at these 26 programs did fewer operations than the men. Now, why is that? You know, I mean, there's a million different explanations for it, and so I think, and I alluded to your paper when I said, so this is the first step, is measuring it. Let's see if it's true across all the programs. Maybe there's some programs where it's not the case. Why not? You know, and is it a problem? And then, you know, it made me think, what about our African American residents? What about our Asian residents? What about our LGBTQ? I mean, you know, what other identifiers other than gender are there that might be part of it? And what can we do to correct that? So I would say, for me, the next step is dicing lots of different ways. And Vas talked about artificial intelligence and all the different big data ways we have of looking at things. You know, that's a new kind of exciting challenge for us, an opportunity.
Yeah, I don't think I have anything new to add, but I would just sort of, as a from a research standpoint, I'm trained as an epidemiologist. I think data is particularly important, and I do think that as we are doing efforts around increasing representation of women and minorities in medicine and science, that it's really crucial that we make sure we have data so that we can actually monitor our processes and progress. And if we aren't making progress, examine like what are our current programs. If it's not making an impact, then how do we retool it and reshape it so that it, you know, it continues to make an impact? Because I do think that you know, diversity of thought is particularly important, and I think the intersectionality, not just of women and minorities, but women in other roles, there are a lot of intersections that we don't think about that impact the experiences that we have. And so really being able to encourage individuals to really be the best that they can be and to actually be comfortable, you know, sharing their experience and journey so that it actually enriches the whole environment in medicine and science is crucial.
I was just going to summarize and say, you know, please rest assured that I do view Hopkins as a leader in this, battle's the wrong word because it's not a battle, but in this this area of making sure women are leaders in medicine. And once again, I go back to Dr. DeAngelis, Dr. Haller, what you've done. I think about Linda Freed. I think about Janice Clements right now, our current Vice Dean for Faculty. And I really do feel, and you should know as alumni, that Hopkins is a leader in this area.
Just a final comment. We've got to remember that women are different than men, thank God. And that difference means that there's a whole different way of thinking about things, a different way of creating things. So that if we don't make sure that women and men are treated with equity, I didn't say equality because we're not equal. Men can't have babies, and that's a big difference. So unless we can find a way for equity for both sexes, we will lose half of human intelligence and creativity. So there's a reason to do this and to fight for it.
And bravo. Reviewing your paper from 1996 also brought out that when women were promoted to associate professor, the level of satisfaction from the men in the department increased exponentially. So the men were happier, the men were more informed, and they were promoted at a higher rate too. So it was good for everybody. Yeah.
Happiness is contagious.
Well, thank you. I think we're to the end of our time. I'd like to thank my panelists because you just did a phenomenal job of encapsulating a lot of wisdom in a fairly short period of time. And I think some of the things that you said can apply to men as well in terms of, seeking what you want and letting people know that, you want it. But I'm amazed and very pleased with how far we've come from when I was a medical student here. Thank you very much.